Dr. Grantley Cross, consultant endocrinologist, City Hospital, 232. Yes. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting the letter of Keval Shah from Surat, Gujarat, India. He is a doctor by profession and he is preparing for medicine specific OET. He is a registered student. Yes. So now let us start the correction and review with feedbacks for suggestions for improvement. We can write it in the next line. So let's address one point in one line. We can write in the next line. Pull it down to the next line. Okay, right. Right toward the main road. Okay, right in the next line. Right in the next line. So, City Hospital, Suite 32, 55 Main Road, and Newtown. So like this. Dr. Grantley Cross, consultant endocrinologist, City Hospital, Suite 32, 55 Main Road, Newtown. No problem, one line extra, it doesn't matter. Yeah. And next. 24 February 2018. The date. 24 February 2018. This is the date. So 24 February 2018. Yeah, it's always better you write like this date. Dear Dr. Cross, you'll take from here. Dear Dr. Second name, Dr. Cross. Dear Dr. Cross. That's fine. Regarding Mr. Brett Collister, date of birth 21 December 1973. We'll go to the beginning. Yes. Regarding Mr. Brett Collister, date of birth 21 December 1973. Yes. 21 December 1973. Yes, right. I am writing regarding Mr. Brett Collister, a regular patient. Okay, who's regular patient? Your regular patient or his regular patient? Do you need to say a regular patient? So, is it important to write the word patient? Okay. So, in many times in the letters, there may be the words patient, but it's not a very positive word. So, better avoid that one as far as possible. Yeah, now let's come to the word count. So, this is first paragraph, second, third, fourth, 5, 6, and 7 paragraphs. Okay, so you better write in 6 paragraphs. Okay, so write in 5 paragraphs as far as possible. Write in 5 paragraphs as far as possible. It's an ideal size. Introduction, conclusion, and 3 body paragraphs. If necessary, you can write the 6th one, no problem, but 7 is a bit more on the higher side. So let it be 6 paragraphs. And then this paragraph can be joined with this paragraph. That's fine. Okay. So if you see, many people say the last paragraph write separately. Yeah, last paragraph anyhow you are writing separately. If you want to see the case notes, sorry, letter, sample letter, you can see. Here, this is the last paragraph. In this paragraph, it's not mentioned what, in case of any additional information, please contact me. That's not there. Not all letters have everything, even in the SAM. This is an official sample letter. But it doesn't mean that in all the letters, everything will be given. You have to collect information from everywhere. And now you can see here, first paragraph, second paragraph, third paragraph, fourth paragraph, and fifth paragraph. So 5 paragraphs are ideal. So follow that pattern. So better to write in 5 paragraphs. Okay. Sorry. I am writing regarding Mr. Brett Collister. So what type of letter is this? What type of letter is this? Okay, this is a referral letter. This is a referral letter. So it is better to use the word refer. So refer you used here. Okay, that's fine. I am writing regarding Mr. Brett Collister, a regular patient. Okay. So there, to you or to him. So you can say who visits my clinic regularly. Regular patient, I don't think so. It's compulsory. Okay. With signs and symptoms. With, say, you can say the signs and symptoms. With the signs and symptoms. Okay. Here. The is needed. With the signs and symptoms. Suggestive of diabetes mellitus type 2. So, is being referred to you for further assessment and management plan. Okay, fine. That's right. Mr. Collister has no known allergies. Besides, okay, besides, words to avoid in the official OET letter. So, go to official OET website. This is OET website. Okay, there you can check in official OET website. So these are some words. Okay, avoid. This is from benchmark, edu benchmark. So here let us writing mistakes to avoid. Mm. Let us go here itself. Now you can see here list of connectors you must avoid in your OET letter writing. Okay, you can see here and but also in the beginning with capital letters. Firstly, secondly, thirdly, finally. Furthermore, moreover, apart from, meanwhile, later on, hence, thereafter, this. You should not use them. Right. Then, so you have to avoid list of connectors you must avoid in the OET letter writing. Beginning a new sentence, you have to avoid these things. In the middle of the sentence, you can use, right? Then using then at the beginning, okay, you should avoid. Firstly, secondly, all this you have to avoid. And you have written the word besides. Besides, you can see here. You use the word besides. Okay. Avoid Okay, see here. List of connectors you must avoid in your letter, OET letter writing. So, academic connectors, furthermore and moreover, you should not use. Informal connectors, besides, meanwhile, apart from this, apart from that, later on, so also. Okay, you have used so, you have used besides. Why don't you use therefore instead of so? So here you used so. So in the beginning of the sentence you used so. So here you can see informal connector. So is an informal connector. So try to avoid. So in that place you can use therefore. Okay, you can use therefore. Right. You can use therefore. Yeah. Then you have used besides here. Okay. Instead of besides, you could have used additionally. Instead of besides, besides is an informal connector. So don't use it. Okay. Don't use it. Don't use the word besides. Okay. Then is being referred to you for further assessment and management plans. Next. Additionally, he works as a factory foreman. He works as a factory foreman. Yeah. Works as a factory foreman. And is there any information related to that? Okay. Mr. Collister has no known allergies. Mr. Collister has no known allergies. So if allergies are there, you can mention. If there are no allergies, if you do not write, that means he has no allergies. You will not think it's an important piece of information. It's important piece of information. What allergies are there is important information. So if allergies are there, then you will write. You did not write, that means he will not think that you did not write, but he'll think that he doesn't have. Otherwise, this much important information you will not mention. It's not the case. So if there are allergies, you will mention. If there are no allergies, why should you mention? Logic. Okay. So if you do not write, as a doctor, allergies are there, you have to mention. It's a must. If it is relevant, you will mention. But he has no known allergies. Why should you mention that? Okay. Sentence wise, it is right. But relevance wise, think about it. He works as a factory foreman and is married with 3 children. Okay. Yes. Is this important? Is this important? Is married with 3 children, is that important? Okay. Is that very important? If it is important, you can write. Is this anywhere helping the endocrinologist to diagnose his situation, that he has 4 children? What sort of information you are giving? If it is important, write it. If it is not important, leave it. Is this piece of information that he has 3 children, okay, is that important? So what is important? You write. More important. There are 3 types of information. First one is relevant information. Second one is semi-relevant information. Third one is irrelevant information. Now what you are supposed to do is you have to chip in and separate these bits of information. What is relevant information? Relevant information because of the problem. Relevant information because of the person who is going to deal with this patient. Okay. And third thing is the information which is playing a more pivotal part. That is higher level. So take these 2 points. First one is the problem, information related to the problem. Any information related to diabetes mellitus, you must write. That is relevant information. And the information what you think is expected by the endocrinologist, that information is relevant information. Okay. Then family history. If any parent or relatives, okay, hereditary problem is there, then you can write. That is semi-relevant information or relevant information. Okay. Next, that which is not important, that is irrelevant information. Now you have to make a thin line between these 3 bits of information. Relevant information, semi-relevant information, irrelevant information. Relevant information you must write. Must write. Irrelevant information must not write. Semi-relevant information according to your perception. Maybe it may be helpful like that. Okay. So Mr. Collister. So besides, you can say additionally. Okay. Additionally. Additionally, you can say. Otherwise, you need not write. No? You need not write. Just write he works as a factory foreman. But don't use besides. If you don't write also, no problem. He works as a factory man, foreman. Okay. And is married with 3 children. Okay. During the subsequent visit. So the is important here. During the subsequent visits. Okay. During the subsequent visits, Mr. Collister where is the first visit? You're saying subsequent visits. If you say first visit, then you can say subsequent visits. There is no question of subsequent visit here. Where is the former visit to say subsequent visit? Okay. Where is? You can say during the visits. Okay. You write first visit, then you can write subsequent visits. But how are you going to use the during the visits? That's enough. Okay. Is it necessary? Hmm? Is it necessary? Where is the former visit to say subsequent visit? No mention of the first visit. So how can you say subsequent visits? Okay. This is usage. Inappropriate. Okay, because where is the first visit to say subsequent visits? Where is the first visit? Then where is it the first visit then? Okay, today 3 months back he visited. Initially he visited. During the following visits that you can see. Okay, you did not introduce first visit and you are saying subsequent visits. If you say, okay, the second work is, then what is the first work? You did not mention about the first work. How are you talking about the second work? Sequence is important, right? Sequence is a sequential word, sequence, order, wrongly sequenced. Okay, this is pointing to earlier visit. Where is the earlier visit? You did not mention the earlier visit, and you cannot say subsequent visits. During the subsequent visits, Mr. Collister complained of soreness in the left shoulder, body part of the, and the right knee, for which, so soreness in the left shoulder and the right knee, for which, for soreness, okay, ibuprofen was prescribed. Okay, along with that, along with that, along with, so you can use connectors for adding information. You can use these words and also additionally, in addition to, along with, as well as. So these are the words you can use. Okay, they are the most commonly used in poetry writing, and they help in providing more information. Okay, so you can use the word along with. So along with that, a referral, a referral to the physiotherapist, weight reduction. A referral to the physiotherapist is different. Weight reduction. A referral to the physiotherapist was recommended. Is it a referral to the physiotherapist? Is recommended? A referral you have given it. You did not recommend somebody to give. Okay. But you already referred. You are giving a referral letter. You are providing a referral to the physiotherapist who was provided. Here you can say a referral to the physiotherapist, okay, was provided. Okay. Now with that, a referral to the physiotherapist was provided. Comma. A referral to the physiotherapist was provided. Weight reduction. Weight reduction weight reduction was recommended. Weight reduction was recommended. Okay. And encouragement about exercises or encouragement about exercising was offered. Encouragement was given. Encouragement was given. So three different things. They cannot match into only recommended. Referral recommended, weight reduction recommended, and encouragement recommended. How can you recommend encouragement? You will give encouragement. Okay. You provide a referral letter. So three different things are there. So what you can say was given. Encouragement was given. Full stop. The full stop is already there. Okay. Now here you can make this a listing of things. Along with that column, a referral to the physiotherapist was provided, semicolon. Weight reduction was recommended, and semicolon, and encouragement about exercising. Okay. Was given. Encouragement was given. You will give encouragement, or you will encourage. Okay. You can just say exercises, regular physical exercises were encouraged. Simple. Regular physical exercises were encouraged. You could have said that one. physical exercises were encouraged. So like that also you can say. So we can take that one. It's a good sentence actually, but you lost the quality. From A grade it came to B grade. Actually that's an A grade sentence if you have written like that without mistakes. So a referral was provided or given. Encouragement was given. Okay, he was encouraged. Exercises were encouraged. Exercises were encouraged. That's it. Simple, right? You can just say exercises were encouraged. Finish. Why encouragement and recommended? Encouragement about exercises was given. Why? Exercises were encouraged. You can write simple like that. So what we can do is we can remove this full. Okay. Okay. So for which, after for which do you need a comma? Okay. Mr. Collister complained of soreness in the left shoulder and the right knee. For which okay, you can see here how many examples I'm going to show you. 2 examples. The training, comma, for which you will be paid. After for which, is there a comma? No. The picking of the fruit, for which work they receive no money, takes about a week. For which, is there a comma? After which, there is no comma. Then why did you put there? For which, this is not required. Unnecessary. So, comma, unnecessary. Along with that, here you can make a listing of things. We can make a listing of things here. Very good quality. Along with that, I'll show you listing. What is listing of things? Listing of things. Official ET. Write lists more clearly with semicolons. Yeah. So here you see example with comma. He takes metformin, comma, lisinopril and atorvastatin. Okay, this one. Now here you'll write a quality sentence. He takes metformin 1000 mg with his evening meal, lisinopril 10 mg and atorvastatin 20 mg both once in a day. There are too many commas here. You can see. Now swap commas for semicolons. Swap commas for semicolons. That's it. The simple solution to this in the second sentence is to use a semicolon at the end of the description of each individual medication. Okay. He takes metformin 1000 mg with his evening meal. One item is gone in the list. Semicolon. Okay. Semicolon. Lisinopril 10 mg and atorvastatin 20 mg both once a day. So semicolon. Okay. So you can write like that. See, this is official OET, oet.com. Take from official OET. And next, how are you going to make a list of things? Along with that, here you can make a column. Okay. Here you can make a column. Right. And wherever comma is there, you can put semicolon. I'm not correcting this one because this is correct only. That is improvement. That is improvement. Along with that, column means two dots. Okay. So two dots. So column. So there it will be like this. Suppose I'll show you here an example. Of course, I'll erase this one, but you can watch it in the YouTube. Along with that, comma you put. Now what I'm doing is I'm placing a column. Along with that, column, a referral to the physiotherapist. Okay, was provided. Okay, a referral to the physiotherapist was offered, provided, semicolon. Then weight reduction was recommended. Weight reduction was recommended, semicolon, and encouragement about exercise was given. So exercises were encouraged. First, this is how you can write that. Okay, this is how you can write. Yeah, this is my sentence. Yeah, instead of that sentence, you can write like this. So this is called listing of things. I wrote in commas, but I made it even more professional by using listing of things. Okay, this is called a listing fact. Listing things. So writing lists, okay, making lists or writing lists using semicolons, okay. Yeah, that is a quality sentence. Yes. If anybody wants, you can watch it on the YouTube and you can make a note. Because I don't want to show. That's not a mistake. People will think that this is a mistake. No, it's not a mistake. It's correct. This is improvement. Okay. So that's why I removed it. So after 3 months, Mr. Collister visited again. During subsequent visits, you told. No, after 3 months, another visit you are telling. Okay. Right. Hmm. So if you go into the case note, if you go into the case notes, now refer to endocrinologist for assessment and management plan. Yeah, because it's a preliminary diagnosis. You did not confirm. He has to confirm, endocrinologist. He has to confirm. Preliminary diagnosis. Results indicate type 2 diabetes mellitus. Type 2. So further, right. So for a definitive diagnosis, you can send him. They require a definitive diagnosis. Right. So what you write? So you write about his problems in the first paragraph, okay, and write about his background in the second paragraph, okay, and you write others less important in the third paragraph. So, which paragraph? What should you write? Okay, what should you write in which paragraph? So, medical history, no known allergies, infection. This will go into the last. No known allergies. So there is no problem. Take it to the last. Okay, history. February 2006, he had infectious mononucleosis. Now this is 2000, which year? 2018. 12 years before. It's not important now, so it's into the last. Okay, paragraph. This is called organization. Which should go first? Which should go next? Okay. So is this the same case notes? Dates. Yeah. Same dates. Right. These are 2017 visits. And these are 2018 visits. These are the latest visits. Okay, so latest visits. During subsequent visits. Okay, encouragement about this sentence. Full sentence you can change it. Change it to what? Regular exercises or exercises were encouraged. And weight reduction. Here weight reduction was recommended. Or advised. Weight reduction was recommended. And next, exercises were encouraged. Finish. Exercises were uh, advised. Full stop. Full stop is already there. Okay. So exercises were advised or suggested or recommended. You can alter here and here, no problem. Okay. What is that? Weight reduction was suggested. You can say here suggested. Okay. And here you can say okay, or recommended. You can alter according to your usage, which is the best suitable you can see. So, along with that, a referral to the physiotherapist was provided, weight reduction was advised, and exercises were encouraged. So they can say here the same thing, encouraged you can say, were encouraged. Yeah, that's good. Same word, why should we change the word encouraged? Okay, and here recommended only we can put. It's okay. Yeah. And next, after 3 months, Mr. Collister visited again with the worsening of symptoms. Okay, with the complaints of worsening symptoms. With the complaint of symptoms, like that you can say, no? Okay. Something I did. Or encourage or suggest. Okay. Now here, we start again with the complaint of worsening symptoms, we can say. Or you can say with the worsening of symptoms. After 3 months, Mr. Collector visited again with the worsening of symptoms. the worsening of symptoms. He was still overweight, body mass of 28.4. He was still overweight. That's okay. And little adjustments. What is the meaning? He was is the subject and verb, which will go for both. He was still overweight. Okay, that's correct. He was little adjustments to lifestyle. How? How it suits? He was is a common subject. He was little adjustments. Yeah. So here you can say, I have to bring a new verb here and made little adjustments. Okay. He made little adjustments. Little adjustments. What do you mean by little adjustments? You can say few adjustments. No? Small adjustments, little adjustments. He made some small adjustments. Okay, he made little adjustments to lifestyle. Made few lifestyle modifications. Simple. He was still overweight and made little adjustments to lifestyle, or made few lifestyle modifications. Okay, made little adjustments to lifestyle. Okay, die. What is this die? He was a die or he die? What do you mean here? Okay, what do you mean by die here? No adjustment to lifestyle. No adjustment, not little adjustment, no adjustment. How can you use little? Huh? And diet. Was physically overweight and unfit. Did not make any. He was non-compliant to lifestyle modifications. You can say like that. Diet and exercise. No adjustments to lifestyle, no adjustment to diet, no adjustment to exercises. Non-compliant. Non-compliant with the recommendations. Non-compliance to lifestyle modifications, dietary regimen, and exercise program has been observed. Still overweight because of non-compliance to lifestyle modifications, dietary regimen, and exercise program. So you can write like that. Nah? So you're joining sentence parts of two, three different things, and you are putting it with under he was. He was still overweight. This sentence correct. Now, if this he was is common for everything because you're joining and little adjustments to lifestyle, diet. So this is diet. What do you mean by die? You're submitting for correction. You have to check and cross check. Na? I was thinking, what is this die? Okay, diet. So you can put that when he was still overweight. You can separate that sentence, and you can write non-compliance to lifestyle modifications. Non-compliance with regard to non-compliance with regard to lifestyle modifications, dietary regimen, and exercise program has been observed, noticed. Like that you can say. No? This is not just a letter correction. This is a lecture in itself. Okay. So otherwise, say he was common. He was is common. If you take he was and continue reading, he was little adjustments to lifestyle. No, he made little adjustments to lifestyle, dietary regimen. So it is little adjustments. What do you mean by little adjustments here? Okay, means you mean very few or not at all? Hmm? Few, a few, the few. So differs. So in the same way, non-compliance with regard to the recommendations provided for lifestyle modifications. Okay, dietary regimen and exercise. You can write 101 different ways. Okay. So you can put a full stop here. No? Okay, you can put a full stop. Just put a full stop. Remove this and put a full stop. So confusion will be lost. Yeah, put a full stop there. Okay. No need this lengthy sentence. You are not able to match. Okay. So he was still overweight. Right. Then little adjustments. You can put a new sentence here. Then it is fine. Minor adjustments or no adjustments. No adjustment, not even minor. So no adjustment was made. Okay. Absolute non-compliance. Yeah. Non-compliance. Non-compliance with regard to non-compliance with regard to lifestyle modifications, dietary regimen, and exercise program. You can write like that. Non-compliance with regard to lifestyle modifications, dietary regimen, and exercise program. Okay, were noticed. So lifestyle, yeah, that is finished. Non-compliance with regard to lifestyle modifications. Yeah, non-compliance with regard to Non-compliance with regard to what is that? Lifestyle modifications, comma, dietary regimen and exercise programs. Okay, non-compliance with regard to lifestyle modifications, dietary regimen, and exercise programs has been noticed despite being referred to. So like that you can. Okay. Next one. Therefore, okay, therefore we used here. Therefore, so here already we used therefore. So we need not use therefore here. Consequently or subsequently, as a consequence, you can say consequently. Okay. Consequently, comma. Consequently, comma. Some blood tests were ordered. Okay. All right. The blood tests which were ordered, here you can write, revealed high levels of random. This, all these things you can write there. No? So organizing is important. Some blood tests were ordered. Today, Mr. Collister presented with tiredness, soreness in the eyes, and reduced vision. That's fine. This actually, you should have brought in the first paragraph. All the complaints you could have brought in the first paragraph. Okay? All the things, these complaints should have gone in the first paragraph after introduction. Okay? After introduction. So saying today. Okay? They're saying today. Today is 24th February. How can you say today? Huh? 24th February is today, huh? So 24th February is today. So this is sore eyes, still tired. He presented today with sore eyes. No, he presented on 4th February with tiredness, sore eyes. See, how can you say today? So on 4th February 2018, not today. Okay, he presented on 4th. Now again presented with the same content. That is worsening of. That's it. This you have written first, following with worsening of symptoms. Then you write the background. Okay. Today is not today. He did not present today only. It's not the first time. So he presented that the symptoms which he has mentioned in the previous visit are worsening. Now, he presented, see here, on 4th February 2018. That's it. He presented with tiredness, sore eyes, hypotension, possibly because of dizzy. He feels dizzy, giddy. Maybe because of orthostatic hypotension, possibly. Okay. So missing important information there. So it's not today. It's on 4 February, comma. So on 4 February 2018. So here no need because it's the same year. Okay. 4th February and 24th February. You're writing on 24th February. It's the same year. So just on 4 February, comma. Not today. Today is telling that the symptoms worsened. Okay. So on 4 February, Mr. Collister presented with tiredness, soreness in the eyes, and reduced vision. His vital signs are normal. So order is missing. Okay, confused. First you have to write previous visit here, and then today's visit. Okay. Then Mr. Collister presented with tiredness, soreness in the eyes, and reduced vision. His vital signs are normal. Or his vital signs are unremarkable. Better word. Okay. Normal or unremarkable. What is the power of these words? Yeah. Normal. What is the power of the word normal? It is A2. A2. A1 is 0 to 100 marks. Okay. A2 is 100 to 200 marks. Let us think like this. Suppose B1. These are even less actually. A1 is 0 to 50. B1 is 50 to 99. C1 is say 100 to 200. Then B2 from 300 to 350. C1, yeah, 350 to 450. C2, 450 plus. A2 is a very ordinary vocabulary. Okay. So now let us take the special word unremarkable. Unremarkable. Unremarkable is the opposite of remarkable. So remarkable. Remarkable is B2 vocabulary, better than that. And unremarkable will definitely be above that. So instead of A2, use B2, which is more probable. Okay. Unremarkable, meaning is ordinary and not interesting. Right. Yeah, today. So on 4th February, Mr. Collister presented with tiredness, soreness in the eyes, and reduced vision. His vital signs are normal. Okay. Moreover, can you use this word moreover? Can you use this word moreover? Hmm. A blood test requested earlier revealed high levels of random glucose, fasting glucose, and HbA1c levels. Okay. Moreover, yeah. Moreover, can you use this word? Moreover, you cannot use this word. Moreover, furthermore, cannot use this word. Okay. So this word. Avoid a moreover in the official OET. Okay, moreover. Moreover is an so avoid using the following connectors in OET writing. So all this for avoiding. Okay. Avoid these connectors. Academic connectors, informal connectors, outdated connectors. Furthermore, is an academic connector. So avoid it. Avoid academic connectors. Informal writing in OET. Highly academic. Formal words you can use. It's highly academic. So avoid academic connectors. So avoid academic connectors. Avoid informal connectors besides meanwhile apart. Avoid outdated connectors, hence, thus, thereafter. Avoid them also. Avoid academic connectors. Yeah, avoid academic connector. So you can just start with the blood test requested earlier. Review. Already you requested earlier, so no need to say. The blood test revealed high levels of random glucose, or you can say blood tests which were ordered revealed. Okay. Yes. The blood tests which were ordered revealed. They are just the blood test revealed. That's enough. Okay. This is not necessary. Okay, that's understood. So sequencing, organizing you put the other things you are telling there and you are telling here these things. Why don't you join these two things together in one place? That is ordered blood there and this is another one. Okay. So this is fourth, that is earlier, and today is what date? 18th February. Okay. A blood test revealed. That's enough. Blood test revealed. Enough. The capital letter. Yeah. Okay. The blood test revealed. High levels of random. So the what happened here? Wait, put this thing. Yeah. The blood test for this. Yeah. Yeah. That's right. The blood test is necessary. The blood tests requested earlier revealed high levels of random glucose, fasting glucose, and yeah, high levels. You can say extreme levels. Better word. What is the difference between high and extreme? High. High is A2 vocabulary. Extreme. Extreme is B2 vocabulary. So use better words. Then, and the blood test requested earlier revealed high levels of random glucose, fasting glucose, and HbA1c. Also, high levels of cholesterol are found. Also, we are writing in the beginning. Can it be used in the beginning of the sentence? Let us check. Also, avoid also with a capital letter in the beginning. Don't use it. Okay. List of connectors you must avoid in your letter, OET writing letter. List of connectors you must avoid in your OET letter. Many people write like this. They'll say, okay, not excellent. So also should not be in capital letter. They remove that one. Why do you want to write also in the first place? Yeah, also avoid. Avoid the word also in the beginning of sentence. Just start high levels of cholesterol are found. Okay, avoid also. Avoid. Okay, avoid the word also in the beginning of the sentence. Hmm. High levels of cholesterol are found. Start with capital letter. Yeah, this is high with capital letter. High levels of cholesterol are found for which he has been suspected with that. You can say consequently. Okay, because high levels of cholesterol are found or separate. Diabetes mellitus type 2 has been suspected. Okay, high levels of cholesterol are found. As a result, or consequently, did we write the word consequently anywhere? They are there for additional. So here we can use the word consequently. Mhm. Due to the high levels of concentration of cholesterol, okay, on account of high levels of cholesterol, or because he has high levels of cholesterol, type 2, diabetes type 2 mellitus has been suspected or is suspected. Okay, high, for which he has been suspected of having diabetes mellitus type 2. The signs and symptoms suggest diabetes type 2 has been suspected of having diabetes mellitus type 2, for which he has been suspected of having, or for which he has been suspected of, due to which, not for which, due to which. Okay, we can say and therefore. Yeah, can say and therefore here. As a consequence, we can say. Yeah, and therefore is better. Oh, and therefore, comma, has been suspected. Type 2 diabetes mellitus is suspected. Therefore, type 2 diabetes mellitus is suspected. Why so long? He has been suspected with. So he is removed. Okay, with is removed. And therefore, diabetes mellitus type 2 has been suspected. Finished. He has been suspected of having diabetes mellitus type 2. Diagnosed with type 2 diabetes, okay, but suspected, okay, of having diabetes mellitus type 2. In view of the above, further assessment, further assessment further assessment to confirm the preliminary diagnosis. Further assessment to confirm the preliminary diagnosis. Further assessment that he has type 2 diabetes mellitus. They are only showing signs and symptoms and giving a preliminary diagnosis. You will confirm it. In view of the above, further assessment to confirm the possibility of, to confirm the preliminary diagnosis. Further assessment, comma, a definitive diagnosis. Oh, further assessment, hmm, and therefore, Further assessment. Further assessment. A definitive diagnosis. Okay. And an appropriate management plan would be profoundly beneficial. Yeah. And this one you can write in the continue in the previous paragraph. If we can write attached to the previous paragraph. Together it becomes conclusion. This one. So should you require further information, kindly feel free to contact me or do not hesitate. Kindly word you can use there. Yeah. Mm, can mm, you can join this sentence to the previous paragraph. Together it makes a conclusion to the previous paragraph. You can join this sentence to the previous. Mm, yeah. Next here you can say kindly. Kindly. Okay. Or please. Kindly or please. Kindly. Please. Anyone you can use. Some people will use two options if I don't mention. One only. Here sincerely leave two lines and general practitioner. Yeah, that's it. Okay. Level 1. That's Mr. Brett Collister. Diabetes mellitus type 2. Diabetes mellitus type 2. Dr. Keval Shah. Medicine. Right. Only. Yeah. File save. Yeah. So Mr. Brett Collister. Mr. Brett Collister. Diabetes mellitus type 2. Dr. Keval Shah. Events. Okay. So that is the correction for you. Right. Is that clear? So this was a special episode for you. So Dr. Keval, you can unmute
Yes, sir.
and you can start your video. Yes. Yeah, you can share your 1 second. Yeah, you can share your video. You can talk about what you learned.
Yes, sir. I've done so many things, the grammatical errors and what connectors to use, what not to use, how to form sentences, what should be the subject, and where to end the sentence and where to begin the new sentence. Also, I have, yes, sir, I'm so much confused about what information to add in which paragraph. So, can you just clear me that?
Okay. So you have got some idea now. Slowly, slowly, you will be learning because we have taken a lot of time now and we'll see that in the next session. Okay. I'll explain you in the next session. See, the thing is, you can write about visits in one paragraph, and next one, you can write about the background story and his history, personal history, medical history, social history in one paragraph. Okay, like that you can separate and what you are expecting, the conclusion. Okay, what you want him to do. So you can write like that. Right. Yeah, you can see here. So this visit and this visit will come in the first paragraph. Okay. The two visits will come in the first paragraph because these are the main problems. So what complaints he presented? First he presented with some complaints on 4th February. After 20 days also this did not subside. In spite of that one, they worsened. So that's why you're sending because it's out of your hands now. You are diagnosing it as type 2, you are preliminarily diagnosing based on the signs and symptoms. So now you are sending it to the specialist and he will discuss the points. So I was showing the screen there. Yeah. So this is the visit, latest visit with problems, tiredness, sore eyes, and all these things. And these symptoms worsened, deteriorated, arrow mark down, deteriorated, tiredness deteriorated, decreased, no, deteriorated, sore eyes deteriorated, vision reduced, like that, worsening symptoms. Yeah, then you can tell the other points about the history, family history, social history, personal history, everything. Okay, all right. His lifestyle, all these things. So his medical condition, first paragraph. That means body paragraph 1 after introduction. Then is weight, obesity. Then his condition, physical condition, mental condition, social history, family history, all you write in the next one. Right. So that is the end of the session for today. And if anyone wants to get feedback like this, you have to get back to me. And this is my contact number. Yeah, +91 98 67360. You can contact me on this number for subscriptions. See you all in the next session with more letters.